Hello everyone, I'm Chris,
I'm Steve.
and we thought we would do a video that would kind of explain Steve's treatment that he went through for multiple myeloma for people who have been diagnosed or is just curious what a typical treatment might be. So we thought we'd just kind of break out what he went through and kind of give you a
little overview on
little
that.
overview. Yeah.
So back in early 2014, for probably many months, I was having a lot of neck pain, kind of neck and upper back pain that persisted. It would come and go, kind of get a little worse at times. And so I did many things, tried to back off from working out, see if that helped. I did, just home exercises, rolling, stretching, and even ended up after many months going in and getting it checked by a doctor. And nothing really panned out from it. Things just kind of continued to get worse over time. And then there was an episode in kind of mid-October of that same year that I was on wet grass, and I kind of did one of those slips where you almost fall, but you catch yourself, and instantly it felt like somebody, stabbed me with a knife, and I almost blacked out from the pain. It was pretty horrible. Mm-hmm. At that point, I couldn't move my neck, and we're now in retrospect, we think that's when, the vertebrae kind of collapsed and in my neck. And so within the next few days, I went in and ended up getting an MRI, and I noticed they were just continuing to go down and down and down my spine. I thought that was really odd, and found out that, they found some things, and after an hour or so, at the doctor's office, they came in and, were sad to say that they found, something that looked, what they thought was, either multiple myeloma or possibly metastatic carcinoma. And
which basically means metastatic carcinoma means that cancer that maybe started somewhere else and then moved into the bone.
Yeah, or
so
anywhere
else in the body. So it's come from somewhere else.
And having, being a doctor and having, a background in imaging, I thought, well, probably not metastatic, because they did basically my whole body and they would have found something somewhere else. So they were pushing more towards multiple myeloma, but they wanted to do other testing to find out exactly. And so they did, multiple testing, blood, urine, PET scan, CAT scan, pretty much everything that you could do within the next few days. Luckily, I was able to get it done pretty quick.
When you're a doctor, you get the hookups and get in faster than other people.
But it was allowed us to really figure out what was going on and then initiate treatment as quickly as possible. And then we were referred to a doctor that we interviewed and really liked. And luckily it was really close to my office, so I could go there for treatment. So.
And if you want to see our video about choosing your provider, we have an episode on our YouTube channel that talks about that and how to choose your doctor. So,
yeah. And so, at that point, we needed to kind of get going. The initial treatment was radiation, especially for this kind of area of my neck, where low neck, upper back, where the
major tumor was.
Yeah, there was a couple that one had collapsed a little bit and another one was getting ready. So we did radiation, and that was 12 sessions of the radiation in succession. And shortly after, the pain started feeling much better. I could move, and it was really helpful. Then within a couple weeks, the pain started coming back, and I realized that something else was wrong. And they did another MRI and found that the vertebrae had just completely pancaked. It was very, very, just flat as a pancake. So immediately they said, we have to immediately set you up with a neurosurgeon to evaluate whether surgery is done like right now, or hold off if possible to start the treatment of the chemo, because that was something they needed to do right away, but couldn't if I had to stop halfway through and have surgery. So the doctor basically said, hey, we think you're safe to start the treatment. So we did that. So.
And then from there, Steve had 5 months of chemo, which was an oral chemo pill, Revlimid, that he took every day. And then there was also an injection that he would go twice a week to have an injection in his stomach, which was Velcade. And then he also took dexamethasone, which is a steroid. And I think that was all you took during that initial round. And that was about 5 months. And once they tested him after 5 months, they did like bone marrow biopsies to stage his disease and things of that nature, and did blood every often. And MRIs. But they found that his cancer was gone, which is amazing. And we were so grateful that he had responded really well to therapy. But because multiple myeloma is considered an incurable cancer, your best chance for it not recurring, they won't even say you're cured, like ever, even if it doesn't come back. But the best chance for it not to come back is to have a stem cell transplant. And I always like to preface this with the stem cell therapies that are out nowadays. People think, oh yeah, I had that in my knee. I went to my doctor's office and got, stem cells in my knee. And I'm thinking it's way, way different than that. And it's way more involved. So after his radiation, they were going to start doing his stem cell harvesting. And he had an autologous, basically, I'm sorry, I'm not a doctor, transplant where he uses his own stem cells. Sometimes people use donor cells because they can't use their own cells. So he used his own stem cells. So there's a protocol for harvesting them and getting them out of you. And I'll let you talk about that.
Yeah, and they suggested, didn't even make that an option where I use someone else's, because the morbidity rate is, about, I think they said it was like 35%. So not a very good for multiple myeloma anyway. So
people do it though, but if you can use your own, that's their first option.
Yeah, and anyway, and that's what we ended up doing. I had to get ready to do the harvesting, which it's a pretty in-depth procedure. I had to get a catheter, Hickman port catheter, that was put in my neck, and I think that ended up being in there about 10 days. So that's
12 days. 12 long days.
Not
to have
fun
this
to try to sleep with you're basically going into your it was into the jugular and down in close to the heart, and then it sticks out and it bifurcates, and then you go in, and it was about a 5-hour process that you do daily, depending on how long it takes to get to the appropriate cells. And so
before that, though, they give you drugs to help your body mass produce cells.
Stem cells. So basically, also stem cells are just immature cells that your bone marrow produces that can turn into white cells, red cells. You don't really know by looking at them, but they will change into that. So they're just immature cells. So we went in, and after having the drugs to stimulate that, we started the process, and it's about 5 hours a day. So I'd go in early before work, and they'd
He didn't work. He didn't work when he had the catheter sticking out of his neck.
Well, I did for some of the days.
Maybe a couple, but mostly, it was.
But that process, you go in, and the blood comes out in one end and goes into the machine, centrifuges, comes back in through the other side, and just circulates for 5 hours, and you just collect those cells, and hopefully it can be done. They thought it would take 2 to 3 days, and ended up taking 5 days, and we just barely got enough for two
transplants.
Hopefully that other one, we freeze them, and hopefully the other ones won't be needed. But the process is they take those cells, and basically later on when you're ready, they'll put them back in your body. And so it's pretty in depth. I had to have a special shot that boosted it because we weren't getting the proper amount. So I'd have to go back down to the hospital at night because it had to be so many hours prior to the. So that was tough. You go down to the hospital twice a day for many days, and you're already sick
you
of
go
the
in the
place.
morning, and we would get hooked up to the machine and sit there and try to occupy ourselves, and then you go home and you'd wait for the phone call. And we're like, please let us get enough. It's like, drum roll, how many stem cells did you get? And I mean, I remember being so disappointed because it's so mentally and emotionally draining, because of the thing, the Hickman catheter, the sitting, the waiting, the unknown. And it took a long time. And I call Steve Superman, and I just say that it's hard to get stem cells from Superman. So anyway, so every day if we didn't get enough cells, then he had to go back down. We live outside of Seattle, but it's about a 30-mile drive to Seattle. So 30 miles in the morning, 30 miles it just got very weary on us. So once he's got all his stem cells, we then prepared for transplant, which ended up taking longer before they harvest the stem cells, they give you a high-dose chemo. I don't think we mentioned that. A few days before, they give you a real high-dose chemo to kill any residual cancer cells, should there be any in your blood. So that was a pretty whoop-a-doozer.
Yeah, and up until that point, really nobody, unless I told them, really could even tell I was, under
Sick.
treatment because I didn't lose my hair up to that point. But at that point, I did.
He lost all his hair.
And then I think at that point, it's starting to kind of grow back, and then we get going to do the transplant, and you go in. I think we went in on a Monday, and they hit you with the drug that the chemo
basically
that
kills
your bone marrow. It completely kills your bone marrow, and so the bone marrow's job is to produce red and white cells, which you're basically your immune system and your oxygen carrying capabilities. So 2 days later, you go back in and introduce the stem cells and hope they go find their way to the bone marrow and start producing,
start grafting is what they call
grafting and starting to produce more cells. And then we're just waiting.
That's another waiting game.
Oh, there's one neutrophil you got, and
I think it took 11 days before we had evidence of grafting, and every day we went to the hospital for blood work and to be monitored. And during that time too is very dangerous because you have no immune system. So you can't eat any raw foods. You can't, you have to take like all the houseplants out of your house. You can't, you have to just make
visitors.
Visitors, you have to be really careful because if you do get some sort of virus or infection, you have no immune system to fight it, and you have a very limited time before you can get to the hospital. So you have to monitor your temperature, and you feel just like dirt. Like you don't even want to move.
Yeah, for a while it's tough, and right away when we were about ready to leave the hospital after getting the stem cells put in, they told us basically you'll be back. You will have a fever. You will, which they consider 101.4 a dangerous fever that you need to be hospitalized. And you will have a transfusion, all this, you'll be hospitalized. And we were just ready to walk out of the hospital and leave to go home, and we got a call from one of my sons, and who said he had been diagnosed from his visit to the doctor as having whooping cough, and he had been recently at our house, and they said no, you can't leave. And so instead of going home, I ended up staying for I think a week.
It's like 6 days, but then we couldn't go see him until we had been on antibiotics for 3 days,
and I had to be tested, and it was not fun, but and I'll tell you, the hospital, it's okay for a day, but 6 days, and you
don't sleep.
Yeah, I mean, people have it much worse than me, where they're a lot longer. But yeah, anyway, it's not fun. And so we were able to go home. And at that point, though, your immune system is so dropped that you can, I had a hard time just even getting out of the bed to go to the bathroom. And in the meantime, after a few days, they're trying to get you to walk around and a loop around the area where I was being held. And, you're under quarantine. You had to wear a mask. Everybody else had to wear a mask. And yeah, it was not fun. A lot of, there were, I think, about 4 days where severely nauseated, and I think for most of that time I was in the hospital, I was on the verge of vomiting, but never did, thankfully. But when it was just on the edge for 24 hours for days and days. And I think it's much easier than other forms of chemo or other cancers, so I'm not complaining by any means, but just something
to give you an idea of
just
what
something
it's
to
like.
kind of get understanding about, because this could be something that as an individual that maybe has this, it could affect you. And so very, very, very weak. And
I
then
remember
I was
like
home
2
for
weeks.
4 weeks, I think, at home, or 5 weeks
Before I
before
went back to work.
So,
But he never got a transfusion,
yeah.
which was kind of amazing. I think he was the first patient that they've ever had that didn't have a transfusion. So that was amazing. I remember when he was sitting around in the chair and like just not hardly moving, hardly watching TV, and he picked up his phone one day, like maybe 2 weeks after, and I thought, oh, he's feeling better because he had the energy or desire to like pick up his phone and maybe look at his emails or social media or whatever. So that was interesting. But you gradually got better, back to work 5 weeks after.
Yeah, and everybody's different. They told me that, some people take 4 months to go back to work. And I think everybody's going to be a little different in how quickly they want to go back, how fast they can go back. I'm just kind of a person that I'm
He's a
kind of a workaholic, so that doesn't help. But also I just needed to kind of get out of the house and kind of mentally get back to what I thought was real life. And I think that's a big part, because it really helped me get your mind on other things the best you can.
Yeah.
So.
And I think you did exceptionally well because he was so healthy. He had no other health issues before all this treatment. His healthy kidneys, healthy lungs, he was very active and ate well and those type of things. I think that helped him in the long run through the treatment. And
I think, I'm not sure of the exact age, but I think it's kind of early mid 60s is the average age of diagnosing of multiple myeloma. I'm 53 now, and I was 48 when I was diagnosed. And I think, that helps. Obviously, the younger you are, I think you can hopefully be in a little better shape. But anyway, that was part of the process. And so at that point, got back to work, got going, and then we still had to face another surgery of my collapsed vertebrae. So all this time, for 14 months, I was basically walking around and functioning with a complete fractured neck.
Very unstable. Yeah, I was so nervous about it.
It was funny because the neurosurgeon basically says, "Yeah, you're good to proceed, but just don't get in a car accident."
Yeah,
or
fall.
Like I have.
He did fall down the stairs the day he got his port in right before transplant. He sleptwalked because he had the drugs from getting his port. And
I grew up sleepwalking, so it wasn't a crazy thing, but
it definitely was very scary. He had a big road rash on his face from the carpet, and he broke his arm. So we were really thankful he didn't break his neck. He could have.
Well, it was already broken, but
didn't kill him.
Surprising, I didn't die, and so that was a ordeal. Another hospital run, but
he wanted to go to work the next morning. He's like, "I'm fine." I'm like, "No, you're not. We're going to the hospital." But so he went in and got his spine fused, a 3-level spinal fusion,
Yeah,
taking a piece of bone from his hip to create an artificial vertebrae to replace the one that was gone, basically.
Yeah. And then, so it's a 3-level corpectomy, they call it, and they took a hunk of bone out, shape it, and make a wedge, basically a spacer where the bone was and the disc above and below, and they take that out, put the spacer in, fuse it, and plate it. And, obviously those that don't have fractures or problems like that, they wouldn't have to go through that, but in my case, in many cases, fractures are sometimes the first diagnosis, the first thing that can help diagnose the disease, and because it does affect the bone marrow and basically transforms the bone matrix, and instead of having normal bone, it's tumor. So had that, and that was a process.
Had one of those big neck braces.
9 weeks, I think.
9 or 12. I can't remember. It was a long time. Hard to sleep, hard to do things. And then after that, he went on maintenance chemo, which is not uncommon for this disease. He took Revlimid every day, 21 days off, 7 days on, or 21 days on, 7 days off.
For
3 years.
3+ years. Yeah.
He ended up stopping it because his white blood cell count would just not stay up enough. And he has yet to change any treatment with that, just to stay where he's at now.
And I don't know, how long has it been? A year plus?
A little over a year that he's been off.
And so far, so good. I'm, I go in every 3 months and get blood to check
all the different tests.
And, they know what to look for, and so far, so good. They just don't have enough evidence on, the drugs that I was taking to see how long it is helpful for. So things change. It's been 5 years, and the advancements are just even that much better. So I think people that are diagnosed nowadays, they might even, who knows, they might even have different drugs and drug options, and hopefully better outcomes. So
anyway, we just hope this is helpful to you and kind of let you talk through. I think that whole process was about 15, 16 months long until the surgery, and then another 12 weeks. So, and it's still been seems like it's been longer. It's just not over. So it's never over.
And again, that was our
story
process. It could be, better, it could be worse depending on the severity of the disease. And, but I think just having some information to understand what you might go through, some different processes, hopefully it's helpful. This is what we're doing this for no other reason, just to educate people and make maybe things easier for them. If those that get multiple myeloma need to go through. So
it was a long journey, but you're gonna make it. If this is you, you're gonna make it. Keep your head up. Stay strong. Take it one day at a time. And when you look at the road ahead, I think that's where you can get super overwhelmed. I remember in the beginning hearing, excuse us, that's our dogs. I remember hearing, oh, well, they're going to do this, and then 5 months later this, and then, and you're just like, whoa, like, it seems so long.
Take each day one at a time. It'll go by faster than you think, but
don't overwhelm yourself trying to live all the way to the end every day.
And if you have questions, we'd
comment.
love to try to help answer those.
And follow us on social media or comment below, and we'll be happy to answer. Take care.
All right. Bye. Bye-bye.